Jim Joyce, season finale, my
did it.
friend.
The season finale. Season
Longest,
9.
Yeah, season 9, longest. Yeah, you got it. You can count till 9. That's good. As a CEO of a publicly traded company, you can count till 9. Congratulations.
Thanks.
But what we just started saying, right, that it's the longest season, like because of all the travel, right, all the stuff, and just coordinating now schedules. So I think we missed, I want to say like 3 weeks so far, 3 or 4 weeks in total in 9 seasons, which is not bad.
Is that all?
Which is not bad.
I think we've missed is only missed 3. Yeah, that's pretty impressive. I assumed one. I was just a complete golf ball on one.
Listen, it happens to the best of us. It's all good. I think you had a good excuse. Yeah, and then I don't know, man. I think you had a board meeting, which give you credit. So by the way, this is I think our 97th actual episode.
Wow.
So I mean, it's crazy, right? So a few more, and then we're gonna hit the 100. But anyway, I know we also kind of mentioned some funding rounds and stuff. I think we kind of gave up on it because we're just, I don't know. Personally, I don't care about the funding rounds anymore. I don't know. That's just me.
Yeah, it seemed like probably funding rounds early in the digital health was such an event, right? Like it's just like, hey, they raised like, that company, and that was a real tastemaker.
Yeah.
Because they raised 10 million or 5 million or whatever the number is. And then now it's almost like trying to track technology now. It's just like mainstream, like digital health companies will get funded.
Exactly. Well, on that note, speaking of digital health, but also speaking about pharma, let's let in our friend Hicham Naim. And I'm sure, even though we've known each other now for I think a couple of years.
Hey,
what's up?
Hicham.
Hello. Hello, everyone.
Nice to meet you. Cool headset.
Jim, Hicham.
Thank
Jim.
You. Hi, Jim. Nice meeting you.
Nice meeting you. I think I've seen you in the social media universe. I feel like I know you at some level.
Also, Health Excel, right? You were. I'm sure you were in and out of some of the meetings at Health Excel. So the Health Excel crew. I mean, we always joke around, right? Like I think our, 90. This is 97th episode, 97, 98. I forgot what I even said earlier, but somewhere around there.
97.
But I think pretty much most of the people lead somehow either to kind of the Health 2.0, Matthew Holt umbrella, or Marty and team at Health Excel. I think we can tie that the two degrees.
DTX also.
DTX.
Yeah, indeed.
Exactly.
But so for the millions and viewers and listeners, Hicham, why don't you take us on a journey of who is Hicham, where are you from, what your background is, whichever way you want to go, and then we'll interrupt rudely throughout the process. Yeah.
Chaotically and rudely is our style.
Well, that's amazing. So I must be the million and one then. So I'm Moroccan and Swiss, so I have this nice mix. I born in Morocco and grew up in a Jewish school from kindergarten till I reached university. So I was an amazing experience and still bring it back with me. Like it's an interesting background. I studied pharmacy, so I got a doctoral degree in pharmacy, then worked in a hospital and also biochemistry lab. Then one day I had this crisis of mind. I was doing my residency and say, I want to do something different. So I left my residency and joined Pharma to do R&D.
Okay.
And after R&D, I say I want to do something else. So I did sales. So it was the early days of pharma where basically in your car, in the back of your car, you have all the samples. And you go to the doctors, you detail the product, and then you leave 1 or 2 samples. And in Morocco, if it happened, was in Morocco and in North Africa.
Oh, wow.
North Africa.
Wow.
It was amazing those days because if there is there's like a public servant, sometimes I ask, what do you do? I work in pharma, so do you have some samples for me also? Yeah. And I did marketing, sales, like the usual suspect in pharma. And then I had again my 30 years crisis, so I decided to quit. So I took 2 years of sabbatical. I studied MBA, and I was working as a freelancer in consulting.
Okay.
And after that, I joined Ernst & Young.
Okay.
And almost like 10 years of consulting with Ernst & Young and KPMG.
Still in Morocco.
Sorry.
Still
no,
in Morocco.
That's in Europe actually. So I lived in 5 different countries.
Okay.
So I left Morocco, studied, did my tour, worked in consulting in Switzerland. I've been anywhere. Actually, I was like at 80% airplane, somewhere in Europe, and then somewhere in the world. So like a project in South Africa, Kenya, then in India, then in New York. It was an amazing time. But consulting sometimes it means that you don't have necessarily a good private life or a good work-life balance, because you're always between airports. You know, the movie Up in the Air, I think is the best example.
Right.
So I wasn't obsessed about, having my mile going up, but it's somehow is the same, right?
Is that the one? Is that George Clooney, or is that the one?
Exactly.
I
think it was the George Clooney one. Yeah.
Yeah, you're the George Clooney of pharma. Is that?
I won't say that. There are a lot of people like me, or at least like I was before. And after I joined Takeda, back in 2016, I led strategy for Europe and Canada. Then led something that is close to my heart. It's customer experience. So I try to put in place customer experience capability. Then I joined a global team where I was leading up to last month a team that is spread all over the world. So I had people in US, China, Japan, and Europe. And it's an accelerator program called Integrated Personalized Care Program. So we're looking at the full care package continuum and what are the unmet needs and what type of solution we can develop for patient, provider, and payer, but also how data science and technology can enable that. It was an amazing experience. And
I think this is how we crossed paths at some point.
Right.
I don't remember the magic moment when we met. I'm sorry, Hicham, but
there's always a magic moment.
It is always a magic moment, exactly.
And then the 97th episode of Shot of Digital Health to cap off the career.
But yeah, I don't think our career is like linear and up. It's I love the book. I don't know if you have read the book from Dave Epstein about Ranch.
No. Which book?
Ranch.
Okay. Range. Yeah.
That's my French accent now.
I like it.
It's an amazing book. It's an amazing book, and it talks about being capable of this horizontal and being a specialized in something.
Yeah, lovely.
So before we dive and peel that onion in pharma, because this is, I still have, tie marks on my back. But as far as like the pharmacy, and I actually I just went to the American Pharmacy Association. Actually, Jim, you and I, right? We did the shot on stage a bit, but Risa, who was who joined us here on the shot as well. I mean, I my summary is that everybody wants the pharmacist to do everything pretty much, because they're really the front door and the front access. Like, where did you leave the pharmacy world, right? I'm curious, just back up. I mean, it sounds like you went to consulting, you went, pharma, but pharmacy. And why? Why did you leave it?
I didn't leave it. I mean, when you're a pharmacist, you're a pharmacist for life. Or
forever,
a doctor or nurse, you're for life. In the old days, pharmacy is called apothec, right? And an apothec was basically not a pharmacist, was a pharmacist, physician, intellectual person of the village. And I don't think I left it. I kept at least a couple of things like this head of healthcare professionals. So when you think about solution, when you think about a new product or we're about to launch, you look at it from not only from someone who is working in pharma, but from a healthcare professional also. When you think about patient, you think about that too. I don't think the healthcare professional work, it's not a work, it's almost like a mission. So people who decide to be a doctor or nurse, They say, I don't want to be doctor to be rich. I think there is something deeper, and you don't lose that even if you move to
right.
other area.
And building off of that, like, you know, we had Risa, who's, you know, she's kind of head of partnerships for the American Pharmacists Association. And she had, you know, had this great vision that she laid out for us of the role that the pharmacist is going to play as being, you know, the kind of adjudicator and onboarder and trainer and, you know, front door to digital health technology. Would you share that view?
I share that view. I mean, I remember a paper I've read back in 2000. I don't want to say something stupid, 2008, 2009. And they were talking that days, a while ago, they were talking about the fact that pharmaceutical industry, they would try to tackle one big problem of healthcare, which is adherence to treatment. Back on those days, I think it was estimated around 500 billion in terms of loss of value.
Yeah.
And what they say, one of the most underused resource was the pharmacist. I mean, they are in front line, and hopefully, hopefully now they're not only pharmaceutical industry, but the whole profession and the whole industry and the healthcare system understood the value of pharmacist. It's not only here to fill prescription, it's to play the role of basically in the front line. In France, pharmacies are not called pharmacists. I mean, you have pharmacy, but what they call them is espace santé. It's a space, it's a health space, because you can go there even if you don't need to fill a prescription. If you have a cold or something, you ask first your pharmacist before going to your family doctor or to
Yeah. And you know, but it's, if you think about it, it depends on what country you're in. It's also kind of the healthcare system of the doctor, the nurse, the pharmacist, you know, amongst lots of other professionals. It's probably the most corporatized aspect of the system, you know, meaning if you're a practicing pharmacist, you know, in Europe, in the US, there's a really good chance that you're working for a big, you know, private company, like one of these big, you know, pharmacy chains like Boots or, you know, CVS or Walgreens in some ways.
Yeah, that's true. But I think also within those type of chain, there's a change in the role of the pharmacist now. I've seen that also. My brother is a practitioner pharmacist in France.
Yeah, vaccine shots,
for example. One of those example, but also like my brother, what they did during COVID, they also put like a telemedicine booth. So basically, you go there and have your consultation with a doctor via telehealth and fill the prescription. But also you have additional services, like for instance, they go and visit elderly people that cannot come and fill and check on them. So they have almost like a social worker role.
Right. Yeah, totally. I mean, I'm convinced, like, I mean, with like my own company with Health Beacon, you know, we see the pharmacists as, you know, like in it, but it's kind of working with them like as probably the right people to introduce our technology to the end patient, you know, as they'll understand it, they understand the need, the demand, they're not removed from the patient, you know, they have the practical challenge of administrating a prescription and, you know, we see it as there, but the infrastructure almost to allow them to get out of prescription filling mode and to kind of move into that space is still, you know, it's on an evolution, right? It's not there today completely or always.
And also the education system needs to change. It's basically reimagining the role of pharmacist or nurse, because this is another resource that is underused. And the way they're trained and the role they would play in the society needs to be reimagined. It's not only infrastructure.
Before we get to the reimagining, because I do want to get to the reimagining, maybe just dive in. And again, you know, we've had many guests from the pharmaceutical industry, right? I think, you know, all three of us went through it or still going through it. I want to get Hicham's view on digital health, digital therapeutics, and kind of the role in pharma, because I know we've chatted separately and I do think we're very much in the same page, but I want to get your thoughts and view on it.
Yeah, I mean, first we all agree there's not one pharma, but I think
and even within that, right, the franchises,
it's not
brands,
one franchise.
Yeah, it's
pharma.
not. Yeah,
exactly.
Yes, agree. Absolutely agree.
And,
yes.
Yeah, I think the very first thing we need to look at it's what type of pharma are we in, or what portfolio you have, or therapy area you're present, but also combine that with what is the relative contribution of digital health intervention to the portfolio. If I make it, if you're neuroscience, contribution of digital health intervention might be completely different if you're in oncology. And based on that, you can start thinking, what if I'm a pharma, what could be my strategic intent for those digital health intervention? Is it for me to provide more services and therefore improve adherence to treatment and show that I have a positive health outcome? Or is it a way for me to collect EPROs, reported outcome, and then demonstrate that there's an outcome, or complement the evidence I have about my therapy? Or is it something that completely different, like in neuroscience, is it a completely new mechanism of action? And here I'm not complementing my data set and my evidence, but I'm basically completing my portfolio to basically strengthen my leadership in a certain therapy area. For instance, the development of treatment for Parkinson or Alzheimer or other therapy, you might think that beside the biological or chemical treatment, you might have also digital intervention that can complement this and can be seen, why not, as a first-line therapy. Like, for instance, you have today games for ADHD, but also you have treatment. You might see in the future that the game will be the first-line therapy before prescribing a chemical treatment to pediatric patient, for instance. Now, that's my point of view, not the one of Takeda or the one of pharma. I believe the future of DTX is pharma for a couple of reasons. Because they all struggle. I mean, they all chant that they have funding, the valuation is going up, but the reality, there's a big gap between valuation and funding and the adoption in the market. And I think where they struggle is that, first, they don't have the deep therapy area expertise and knowledge like pharma has built over the last 100 years. They don't know how to do science-based engagement. You know, pharma, they know how to do that. If I have a treatment mechanism, I know how to talk to doctors and how to talk to payers and demonstrate basically the evidence of this new therapy. And I think DTX, I believe the future will be it's pharma. And we start seeing that. I think Pfizer, a couple of days ago, bought an app, Rep Apps. Yes, they just.
Oh yeah, respiratory app, right?
Yes, exactly. And I will expect you will have more of those now coming in the next coming months or years. Yeah.
You know, when you think about.
Sorry, go ahead. I was going to challenge him a little, but go ahead.
Yes, please. That's how we learn and grow.
Go.
You know, I think your comment on, you know, they as in DTX don't know XYZ, right? I mean, if I look at, and I won't name names, but again, back to your well-funded company, there's been, and I don't want to say an exodus, but certainly a large number of people, everything from market access to clinical trial to et cetera, really heading into a lot of these companies now with the funding, right? And so, and I actually would say that from that perspective, they, and I put it in quote, they knew the consumer experience in theory, tried to kind of put that into the healthcare perspective, and now adding some, you know, brilliant people from around the industry to actually bring some of that, you know, expertise and evidence. So that's kind of one. I do agree with you that ultimately I see a lot of these DTX, especially PDTs, right? The prescription digital therapeutics, are ultimately being acquired by one of, right? And even if we talk about neurodegenerative diseases, right, as a standalone, well, look, I mean, how long has the industry been trying to solve for Alzheimer's, right? If there is a neurodegenerative piece of software that can help with that, and if I'm trying to fill my gap in my pipeline, well, if and I won't name any names, but if a company is generating now X revenues, even if it's 10 million, 15 million, well, now that's an interesting target to fill my portfolio. So that's how I'm kind of looking at it.
I'm 100% with you. I think to be fair to DTX, and I'm a big fan of DTX and PDTs, disclaimer. There's not one, like we say, there's no one pharma, there's not one DTX. I think we're talking about, we don't want to name them. There are some good ones, and some good ones, they really are taking seriously evidence building. But you have also a lot of snake oil sellers. And that's what I believe on the mission of DTA. What they try to do now is to put some standard, make sure that, the bad players are not visible. But it's still a way to go.
So let's talk like platform versus differentiated DTX, right? So this whole idea that, if you're building a DTX platform that could engage, multiple different kind of similar medications from the pharmaceutical industry and have a benefit and have like, one patient experience or ability to seamlessly, switch between first line treatment and second line treatment, that's one. And then you have one that says, hey, I'm going to use a really clever DTX to differentiate, my product. What's your prediction here? Is it going to go one way or the other, or do we live in a world with both those things happening?
I think what makes sense, you would have a platform play in the future, because also, you came from pharma or you work with pharma. I work with pharma. If I take the oncology example, for instance, where you have a patient that has cocktail therapy, and each pharma is trying to provide its own services. And then sometimes you have DTX company that also propose to pharma specific services. If I have a patient, I end up with 3-4 different offerings. That's a kill, basically. And also, there's no way you can, in a compliant way, collect data and be able to provide what makes sense in terms of intervention to patient based on, based on the condition. I believe that in the future we'll have platform play where those DTX, like you have to the Apple Store. If I'm a patient, if I have a condition and I need a CBT, I can opt in for CBT. If it happens they have a treatment where I need dosing, I can opt in for this dosing app. So I'm saying, and that's if, for instance, I want to use your beacon because I want to track my adherence, but also I want to make sure that the syringes are not lost. I can opt in for that, but I have a seamless experience. I don't care how it works behind the curtain, but I have a seamless. But the question is, who is going to do that? There's a super app or super platform. Who is going to play with that? And be the leader.
Is that in your book?
We're at some crossroads now, but I was actually gonna say, if before we move into it, I was gonna like kind of tweak it into the book thing. That I did a poor excuse of writing one. I started, I think, as soon as I left the big pharma. I want to say 20 Fridays in a row where I wrote like a preview of the chapter, and then Hicham just kind of like, okay, boom, I'm out, it's done. No, it's not. I know it's not done, but I would love to. Mine was the concept with Hard Pill to Swallow: An Entrepreneur's Journey Through the Belly of the Beast. I am still committed to finishing it, and I would love your thoughts and feedback into it. But in that crossroad from my book and inspiration, let's talk about yours.
So first, I think you should continue your book because I love the idea. I think we all struggle with that. And I think you will have an audience. Now, what I learned, and the book is not finished. I wrote the first manuscript, it was approved, happy. The book is not about to say to people what you think or how much you know, but you need to say, I'm not the hero. It's a learning journey for me. And I want to listen to people that are smarter than me or that have done something and have a story to share. And that's how I approached it. So it's not my book, it's a collection of stories and interviews that I'm having with different people. Every time I talk to someone, there's something interesting. Everyone has a story to tell. And I think as a human being, we are social animals and we love stories and we tell all the time stories. And that's the idea. Now, why I'm writing this book? So I have asthma, it's a moderate asthma. And even that, I'm a pharmacist, but I'm not adherent to treatment, which is literally, And I had COVID in 2020, and it was horrible because I ended up in AR. I was like a close call, and at the same time, I had the best service I could have. Now, the university hospital, they were amazing. I benefit from these cocktail antibodies, from Astra.
Wow.
And I
Wow.
can name them because they helped a lot, and thank you. On the other hand, on the other part of the world, my parents have also the same situation, but didn't get the same level of support because
Right.
Morocco is not as advanced as Switzerland, also for other reasons. And I say, so that's the first question. How come we're in 21st century and we don't have the same access to care? Care should be almost like a human right now. And in some places, US, for instance, it's not seen as human right. It's still seen as a cost, not investment in our society. And the second, I was expecting a second baby. So I say, my second question was, what world are we living to our kids? I mean, it might sound cheesy, but there is a lot of relationship about what we are currently doing and how this will impact the future. So I picked 2050 because I say that's basically the time where we will see whether we have met the climate target or not.
2050.
And 2050. And 2050 will be almost 10 billion people. And you, myself, will be the people that are basically a burden to the society also, because we will be 70 plus. And what strikes me is that we will have more people that are 65 than people that are 14 or less. And how, if we live with the same society, if we live with the same healthcare system, we cannot basically bring the same level of care to this larger population. And being elderly means that we have more NCDs. And I don't believe that longevity and others will solve this problem in 30 years from now. So I decided, okay, how about if I listen to people write a book about that and talk about not only the pessimist part, because I'm very optimistic about the future. And one of the questions also, and I will stop because I know that you're thinking technology. There's a lot of, so when I start looking to the books, most of the books are great, but they're all techno-optimistic. And they all talk about gadget from my point of view. They're not necessarily asking the questions about what society we'll be living in. And will technology really make healthcare and health more accessible, more equitable? Or it would create almost like two types of humanities. I don't want to be grim, but if you have seen the movie Elysium, you will have the people that can get the best care, like gene therapy and the rest of the population that still struggle with the basic problems.
Wow.
And what actually, like, what was the aha moment or the inspiration for it? Like, did you just wake up one day, or was it kind of a process?
Like I said,
to do this, or was it tied to the experience?
But the experience actually, when I was, when you're in the hospital for 3 weeks, you have a lot of time to reflect, And
so it was then when it was born, really, yeah.
Yeah, because you start thinking, okay, we have in our cultures something about legacy, and mankind. What I say, mankind is woman or man, needs to leave at least one of those three legacy. One, you already do that, and heads up for you, it's knowledge. It's a knowledge that can benefit the rest of the population or the humanity. And knowledge could be a book, an article, a podcast, something that can benefit people. Even still, you're not here maybe in 100 years, maybe 150 years, but the knowledge you have built, hopefully we will have a podcast in 2050 or 200. The second one is a kid that remembers you. But what we mean our kid is not a kid, it's not necessarily a biological kid. It could be like you're coaching someone, a colleague, you helped someone, you helped someone, basically. That becomes your like a spiritual kid. And the third one is running charity. And running charity doesn't mean necessarily foundation. You did something small, but has impact on people. And even if you're not here, it's still basically, and one simple example for us, if you plant a tree and this tree become bigger and you hide when it's sunny or it's raining, it's a running charity.
Oh, wow.
So it's,
And that's from the Moroccan culture, or
I would say the Middle East, Africa.
Middle East, yeah. So
That's
it's legacy, a kid remembers you, and a charity that keeps on giving.
or a knowledge that can benefit people.
Okay. Wow.
Yeah.
You know,
like
as you're talking about leaving a legacy and helping people, you know, we're in the midst of a humanitarian crisis and war in Ukraine that's ongoing. And I know, Hicham, I've seen you post, I think, Healthcare Without Borders. Talk a little bit. I think I got it correctly, right? Healthcare Without Borders, is that it? Maybe just talk a little bit about what you're doing with there.
So I think Healthcare Without, I need to give all the credit to Mariana. It's a friend of mine. She's actually a fellow member of HIMSS, and she reached out the day one of the war. She said, Hicham, can you help me? Because we need to do something. I didn't sleep, and there are people that are suffering. And I said, how can I help you? And she said, what is do a post on LinkedIn? And we did our first post where we say black Canva, and we say, we're looking for clinicians and health tech or telehealth company who can help us. Bring those together. And that's what we did. And we were overwhelmed by response. The first week, we reached 200 plus clinicians and 20, wow, roughly 20 telehealth companies.
Wow.
And we didn't expect that, basically. And slowly what we did, we vetted those health tech company, the telehealth, and we come up with 5 that we say, okay, those are good. We feel comfortable that they're simple, they can be used by patient in Ukraine. And also we keep having more clinicians. And the good things today is that after 55, 56 days now,
yep,
we are covering almost, I'd say it's more than 1,000 consultations per day.
Wow.
Yeah, it's and other like Massachusetts General Hospital joined us now with their own disaster team. We have Yeshiva University, Katz School of Health and Science. They joined us. And what was also interesting is that RADA last week, they published basically the list of recommended telehealth platforms, 5. And out of the 5, we have 2 that are part of our network. Wow. So we felt, okay, I think we did a good job in terms of vetting them. But I don't think that we should say, yes, we did everything. It's still so much to do. I mean, we're talking about 5 billion plus of people that are displaced. And the war is still there. And there's a lot of, I mean, it's a tragedy. It's a tragedy. We did.
Sorry, go ahead.
I'll quickly finish what we did also. So we have 3 things that we start doing. One, it's doctors to patient. Then we start organizing doctors to doctors. For like, we have association burn surgeon, psychiatric neurolog in US and in Europe that talks also to surgeon in Ukraine. Sometimes you have a procedure, you don't know how to approach that. That's the second thing we start doing. And third one now, it's hospital to hospital. Sometimes they want to know what they need to ask in terms of. So those are some examples of things.
Yeah, I was just gonna comment on so there's a lot to be done, and I'm sort of rewinding back in that even the first week, you know, we went over to the Ukrainian consulate just to find out what's really needed, and they had a very specific list of what's really needed, and that was going on for like, you know, the first couple of weeks. I remember, you know, weeks after, and I think even now, you go there and what's needed, everything, right? I mean, just everything is needed, literally everything. I mean, there's millions of people that are, you know, left things behind, right? You thought about like, well, do people need forks? Well, now, yes, right? Like, so again, just encourage, you know, people sort of ask like, sure, you can donate to the Ukrainian government directly and other things, but I would also say just find your Ukrainian consulate. You know, we pretty much every weekend take a trip, dropping whatever we can off to be
or host families. You can
host.
Host.
I know you're hosting a family.
Yeah. I mean, we still need help. For instance, I give you 2 examples of concrete help, and also come back to you now, DTX. So one of the things we didn't only look to telehealth, we looked also to DTX. And Triumph.health, for instance, they have a game that is validated to help kids with trauma to deal with that. And that's an example of, evidence-based intervention you can use, especially because the scale with this solution, you don't need a lot of clinician behind, but we need help. For instance, with boot shop, and we know that there are more than one boot shop. We'll start looking for experts that can help people that are experiencing rape or have been victim of rape. And there's not a lot actually of experts in the world that don't know how to do that in the context of war, for instance.
Yeah.
Wow.
Listen, we can keep absolutely exploring, how we can be helpful to every individual. We can explore in DTX or pharma or anything else. But I think for the respect to all of our listeners and viewers, Jim, take it away with the last question for this.
Absolutely. So, and you've brought us in a lovely way. You brought us to the top of the mountain, and you've told us how we can be charitable. So I was going through your list as you're talking about, legacy impacting kids and charity and knowledge. So, so if you're staring at, this incredibly charming, successful pharmaceutical sales rep who's driving through Morocco, and he pulls over for a second. He reminds you of yourself, of your younger version of yourself, and he says, Hicham, I have this phenomenal digital health technology idea that's going to become the most impactful application in the world, a platform that every pharmaceutical company is going to want to adopt and integrate in with their medications. You've had such an interesting career. What advice do you have for me? What advice would you give to this pharmaceutical sales rep about to embark on his entrepreneurial journey?
I think the advice. Is don't think about a platform or a solution. Think what is the big problem that needs to be solved. That's what I would tell him. What's the biggest pain point? And I don't think that you don't have one. There's so many. And I was reflecting actually on big tech and where they still fail. They try to disrupt an industry for the sake of disruption, maybe to turn $1 into 2 or 10. They should be looking to some big problem we have today. If I think about healthcare system, for instance, I'm not talking about pharma, because pharma is only 8% of total cost. There is a big inefficiency in the system. We need to solve it. It's not a sexy problem to solve, but it's a big problem. And I think if we do that, we can reduce and make the healthcare system more efficient, but also we can reduce the burden on doctors. And if there's one advice I give to everyone, when you develop a solution, please make sure that it doesn't create more workload to the doctor, because I'm really scared of the next pandemic.
Or the nurse, or the pharmacist, any other actor in the healthcare profession. Yeah. Amazing.
Fantastic.
Well, thank you for joining us. We will add the Crossroads link to our LinkedIn post notes and the show notes. We don't actually have show notes per se. We're not a professional podcast on this one, but we kind of riff on
LinkedIn a little
bit. But thank you for joining us, and for the millions of listeners, share and click subscribe.
Yeah, and glad you've recovered from COVID, and thank you for all your work. I look forward to the book.
And thank you for your job also. You do good stuff with the out of digital health.
Cheers.